think you have known what is the reason today. Reason of this particular meeting had been two. One, to talk on this particular new drug, which Dr. Tempe has very nicely highlighted. Now you have to see to it that you use in adolescent PCOD as well as for people who are looking for pregnancy. And whenever you have a result in pregnancy, say in our forum that you've got a pregnancy, we can collectively use it and we can know collectively that how things are doing. Second has been, which is the most important part of it, people like me are mad as far as anemia is concerned, and I feel anemia is a national emergency. And unless something is done by for anemia, let Modi talk about Viksit Bharat, nothing is going to happen. This is one of the conditions, is that if you want the people should have a double energy, anemia has to be treated. So I'll, before Dr. P.K. Shah speaks about IV iron, I thought let me just highlight a couple of points. This particular graph shows, what is our lekha jokha as far as our hard work is concerned on maternal mortality. The government gives the figures that, the anemia mortality figures are 8, but people like us are skeptical about it. We feel that it's still much more. But you must know, as for the severe anemia is concerned, from in the last 75 years, it has come down from 25% to 2%. And it is this 2% which is killing up our patients. And we must know the red flag for severe anemia is 7. So all of you know what is the red flag for severe anemia? 7. The government of India gives a very clear instructions. All pregnant women with severe anemia should be admitted without fail for blood transfusion and treatment. That particular slide showed that the government of India is also very clear that the treatment for moderate anemia, when it is 10, it is to be treated with IV iron. Failing to do that is disaster, because this patient will be coming to you in labor with severe anemia. So you must treat this particular patient when she is moderate anemia and the cutoff given is 10. Don't wait for it to be 9 or 8 or 7. Crux of the good gynecologist thing is that follow the government instructions. I don't know how this particular slide has been missing, but this is what thing is, that government guidelines are very, very clear. Treat moderate anemia with IV iron. And that's why in the morning I have said, I'm looking forward for volunteers who can teach 70% of gynecologists who are reluctant to give IV iron in your practice. We are going to start 4 centers. One is mine, another is Hegdewar, and 2 people have to volunteer. Where the people who are hesitant to do IV iron, come learn from us. We will not charge anything. You bring your patient, you bring the drug, rest of the things we will do it for yourself. So in severe anemia, things are very, very clear. It is blood transfusion, and for moderate anemia, please don't wait for IV iron. And when you give IV iron, you have to give other supplements as well. B12 भी दोगे आपको, folic acid भी इसको दोगे, diet की भी advice करोगे, diet में vitamin C की भी बात करोगे, और albendazole भी दोगे. Now, main complication of severe anemia for the mother is cardiac failure, which happens in labor and postpartum period. Infection and thromboembolism is part and parcel. Preeclampsia, severe variety of abruptio placentae, preterm labor, and postpartum hemorrhage also are the part of complications. As for the baby is concerned, it's the severe anemia which kills the baby also. And causes are prematurity, fetal growth restriction, and intrauterine death. Blood transfusions is recommended, and for symptomatic severely anemic patients, irrespective of period of gestation. Aim of blood transfusion is to increase the red blood cell and consequently to increase oxygen carrying capacity. Labor brings tragedy of heart failure. You've got to give prophylactic antibiotics. The pain relief should not be neglected, and good documentation of the case has to be there. Goes without saying that active management of 3rd stage of labor, you have to do it. And instead of putting oxytocin in time, drip on the drip, you should give the concentrated oxytocin infusion directly, IV or intramuscularly, and packed cell transfusion. Immediately postpartum period is quite risky for these patients. Intensive monitoring is required in postpartum period, and adequate blood transfusion, rest, and the measures to prevent sepsis are important. Antibiotics should be continued for 7 days. Since these patients are high risk for thromboembolism, early ambulation is required, and breastfeeding can be given. So expectation from you gynecologists is that physicians are expected to save all mothers and baby. Proper documentation, patient education has to be there about what risks are available if you don't get treated for your moderate anemia. You will end up in severe anemia, and the whole problem will be there as a result of that. So you should know great counseling. Change it today is not there. So I have to repeat it. Counseling has to be very, very good and adhere to the clinical guidelines of the Government of India. Effective communications are crucial for mitigating these risks. Thank you very much.